Now, the nerve fibers which carry impulses from the receptors to the central nervous system, what do you call them as? Very easy question about nomenclature. You basically call them as the afferents. So a little bit you need to know about the terminology. So this is the spinal cord. This is the spinal cord. And in the skin, you have the sensory receptors. From here, the sensation, suppose if I pinch you, if I happen to apply a pin and cause pain, pain is called nociception. What is the word used for pain? It's called nociception, right? So, if there is any pain, if there is any touch is called as, what is the word used for touch sensation? We call it as proprioception. Proprioception. So, proprioception, nociception, that is a pain. From the sensory receptors which are there in the skin, they get transmitted by the nerve which is called as the afferent nerve. Then if something is biting you or if you are getting pain, what will you do? Immediately you will withdraw the hand. So how do you withdraw the hand? Once the pain sensation comes to the spinal cord sends a nerve which is called a motor nerve. Motor nerve. That immediately will cause the contraction of the muscle and withdraw the limb away from that nociceptive stimulus. And this is called as the efferent nerve, is what you should basically remember. So, whenever you should know a bit about neuromuscular junction. We are going to talk about something called neuromuscular junction. So, whenever the nerve comes, the nerve brings a electrical activity in it that is called action potential. When the action potential comes, there are certain neurotransmitters, especially acetylcholine. Acetylcholine is the neurotransmitter. Tell me, what is this word? Acetylcholine is the neurotransmitter. It is staying inside these small bags. They are called vesicles. Vesicles. So from these vesicles, this neurotransmitter get released, acetylcholine. It will go and stimulate the movement of the ions, across the membrane. So this is the nerve and this is the muscle. This is the muscle. Hence, what is this called as? This is called neuromuscular junction. This is called as neuromuscular junction. Because this is the nerve, this is the muscle. So, then immediately when this calcium ions are moving, it will change the electrical potential of that membrane. Always you should remember, any membrane, there are positive ions on one side, negative ions on one side. And typically, across the membrane, there is something called membrane electrical potential. So, that membrane electrical potential created by the movement of this calcium ions is basically called depolarization. And this depolarization will make the muscle to contract. That is how a nerve brings the electrical signal, causes the release of the neurotransmitter, which is acetylcholine. That leads to the movement of the calcium across the membrane, and it will cause the depolarization of the membrane, and that makes the muscle to contract. This is called as the neuromuscular junction, right? So this is another way for you to remember. Always you should have a three-dimensional structure of the anatomy, physiology, biochemistry. You should have a imagination, a psychological imagination. Then only you will be able to understand the concepts very well. And always carry a pen and paper. Explain your classmates. Always teaching others is the best way that you can learn the concepts. So you have the axon, that is the nerve terminal, and the neurotransmitter is released. Here you have the synapse that is releasing the neurotransmitter, and that in turn is making the post, this is called as post synaptic membrane. Postsynaptic membrane. And what is this called? This is called synapse. And what is this called? This area is called presynaptic membrane. Very good. And this is called as the nerve. So that makes the postsynaptic membrane to undergo what? Depolarization. Depolarization. And that makes the muscle to contract. Muscle to contract. That is what you should understand. So this is basically the cell body. And how does the electrical signal pass through the efferent nerve? It won't pass like our traffic. It will keep jumping. Like Spider-Man jumps from one roof to another roof. Like that, it will be jumping from one roof to another roof to another roof to another roof. And this is basically called myelin. What is this called? Myelin. So you have imagination of how the electrical wires, there is a copper. Around that, you are having that plastic. No? If you take an electrical wire, inside there is a copper, there is a outside plastic. So there is similar thing called myelin, which is surrounding this nerve fiber. And this myelin will be like nodes like this. And the purpose of the myelin is it will enable the electrical potential to jump from one node to the other node to the other node to the other node. And that is how the electricity can run faster, right? So that is the reason myelinated nerves. There are two types of nerves. Myelinated nerves, which have this kind of a sheath called myelin sheath. M-Y-E-L-I-N. Myelin. Myelin sheath is around the nerve. So you have two types of fibers called myelinated fibers, unmyelinated fibers. Two types of fibers that you need to know. So these unmyelinated and myelinated fibers, if you take the myelinated fibers, they conduct very fast from one node of Ranvier to another node of Ranvier. What is this called? Node of Ranvier. So this myelin will typically present around the nerve fiber, and it create what are called as nodes. What are those nodes called? Node of Ranvier. So from one node of Ranvier to another node of Ranvier, it will jump, and jumping is faster than crawling, right? So that is how the conduction of the electricity happen along the nerve fiber is what you should remember. So now you know, let us have a quick summary of what all that we studied. You know what is meant by afferent nerve, efferent nerve, what is neurosynaptic junction, what are action potentials, how does depolarization happen, how the muscle contraction happen, what is meant by a myelinated nerve, unmyelinated nerve, the node of Ranvier, etc., etc. Excellent.